Now, regardless of when or if a health care bill is passed, health professionals have differing opinions about the content. Fox Toledo's Kristi Leigh just finished speaking with 2 local doctors about the proposal. She's live now with their take.
UTMC's Dr. Jeffrey Gold says it's important to know if passed, the bill would not go into effect until 2012. Dr. Ken Burtka of Mercy Health Partners adds if healthcare reform passes, it will not look exactly like the version the House has just passed. But both agree the latest development is a step in the right direction. Both doctors outlined the positives and negatives of Nancy Pelosi's bill. They say the major positive is 96% of Americans would have health insurance coverage. The bill eliminates rejection of coverage because of pre-existing conditions and has no limit on the top amount spent on a single person. Now, in order for government-funded health care to work, more people would need to participate in the program. Their premium payments help fund the program for all involved.
That's where it gets controversial, because now you're talking about individual mandates. So in other words, the government saying you have to buy insurance, or saying to a business owner you have to supply insurance.
Also, financing the just under $1 trillion proposal is an issue. Increasing taxes would be inevitable. But
there's hope that the majority of this is what the legislature calls front-loaded, which means it will be paid over the next several years as the system morphs, and then over time by reducing waste and redundancy and getting a healthier population.
Doctors also agree if a health care bill passes, it would be a first step because the number of available doctors needs to be addressed. There are just not enough primary care physicians to guarantee access to health care.
It's very much like handing out free bus passes, let's say, but there's only 2 buses in town. So everybody has coverage, but that doesn't mean you get a ride on the bus.
Ultimately, the doctors encourage everyone to do their own research on the bill and communicate with their representatives. Reporting live, Kristi Leigh, Fox Toledo News, first at 4.
Sticking with health care now, the health care passage in the House has some people fired up. In fact, a coalition of conservative groups is pushing for people to stop allowing government to take control. And that means getting out to vote. Our Allison Brown joins us now with what these people are saying.
Well, some say people aren't using their right to vote and it's causing problems. Representatives from groups like the Perrysburg Patriots and Back to Basics don't agree with what's going on in Washington. They say more government control in health care goes against basic constitutional principles, and they are afraid about the concentration of power that it could bring. They say people should have the right to choose what they want.
Make it affordable, make it accessible, those kinds of things that most people need and truly want, and leave the private sector and leave individual decisions about health care up to the individuals.
I think it's a good example of the government getting a little bit out of control and thinking that they're going to take over a huge chunk of the economy.
This group is holding a citizens town hall meeting on Saturday. Basically, the meeting will teach people about strength in numbers when it comes to voting. Their goal is to change the outcome of upcoming elections. Now, that meeting will be at the Maumee Indoor Theater at 1:30. Reporting live this afternoon, Allison Brown, Fox Toledo News, first at 4.
Congressman Bob Latta was one of those Republicans who voted against the health care bill. He stopped by the Fox Toledo studio today to talk about why he voted no and whether there is a health care bill out there that he could support. You'll get those answers tonight, first at 10, during our Talkback interview segment. So what things would you like to see in a health care bill? We're interested. That's our Fox Toledo feedback question today. Now it is your turn. You can head to our Facebook or Twitter page and give us your thoughts. You can also send us an email, and we will read some of those responses tonight, first at 10.